All right. So let me just first start off by me sharing my fur babies to you all. So I know many of you follow me on social media, and this is the latest picture because I had to redo it since we have a new edition. And then right smack in the middle there, say hello to my queen on the far right. There is Chelsea. And then this blonde bombshell right over here is Carl, our newest edition that everybody's loving, that took the internet by storm, unbeknownst to me. I had literally no idea. This is Capone. He slides down the ramp. If you haven't seen his video, you got to see it. So cute. This is my beautiful, handsome boy, Connor. I call him King Connor. And then that guy who steals my shoes down the ramp, that's Clark W. Griswold. So yes, I'm a Doxaholic, and I'm proud to admit it, and I'm perfectly fine with that. I absolutely love the breed. I mean, look at him. This is Capone. So he's a standard wire hair dachshund. So you may not know this. Standards are not that common here in the United States, at least. And so he's going to be a big boy. He's probably going to be about 30 to 40 pounds. I share that with you because understanding what your dogs and cats are made up of or mixed with or have their breeds and know what their breed standards are so important in light of what we're talking about this evening with obesity and trying to keep them lean. So look at this, my friends, an estimated 60%, and actually as of 2022 it's 62% of cats and 56% of dogs in the United States were considered overweight or obese. Just think about that. And if you can, in the chat box, if you think that your dog or cat is overweight, obese, go ahead and say so. We're going to see, maybe we can learn more about it as we progress and go into this. But why do you think that is? Well, part of it is because we equate the human animal bond with food. It's especially here in the United States, we're very guilty of food is love kind of a mentality. And if we see a thin dog, we're actually very, and I see this on social media too, we're very judgmental of them. Like, oh my gosh, they're not eating enough. They don't look good. They're too thin. So that's pretty fascinating. But at the same token, just like on human side, animals are predisposed to obesity. And as we're soon going to find out, obesity is a disease. And I'm going to say that one more time. Obesity is a disease, because that is very powerful and impactful. Because when I go ahead and make that diagnosis of obesity, I treat it as if it's no different than any other treatment plan that's out there. So, that it's important for your veterinarian to realize that the fact that they're going to put a treatment plan in place, they're going to make a diagnosis, and we don't want you to be necessarily like offended by it. It is easy to take offense when you hear something like that, but it's all like how you deliver it.
Got the results today from my doctor. He said I was a beast.
No, he said you were obese.
I just think that's adorable. So as I got the results from my doctor, who said that I was a beast. She's like, no, obese. Oh, okay. And unfortunately, the English bulldog that you see in front of you in that video there tends to be an overrepresented dog breed that tends to be overweight or obese. And go ahead and see if you can in the chat box. I don't know if it's enabled, but what are some dog breeds that come to top of mind that you see in your lives that tend to be like overweight or obese, like when you're taking your dogs out, when you're socializing them, or when you're looking on social media? What are some dog breeds that come top of mind that you can think of that are considered overweight or obese? And so a not so fun fact is that 90% of pet parents with an overweight pet don't realize it. Almost 100% have this disconnect that happens. So this is why we're chatting about it. In fact, there's this huge initiative that's about to be released and rolled out to your clinics that I can't say, but it's going to be happening this year, a very big initiative about that. So we have to make sure that we have this communication with you, the pet parent, and us, the veterinarian, to make sure that when you walk out that door of your veterinary hospital, we have a plan in place, okay? Because it's just not as easy as like, oh, diet and exercise. There's a whole treatment plan that gets put into it, but there's obviously a disconnect that happens. And take a look at this survey too. Almost 60% of dogs are overweight or obese, like we talked about. Same for cats. So more than half of them. And, some of it is with dietary recommendations. There's a lot of new novel diets that are out there. And one thing that I share with you that those of you that do follow me know that I won't make necessary nutrition recommendations on social media, because there's three things that are very inflammatory in the social media space: politics, religion, and pet food. And with pet food, people want to take that initiative to do the right thing. But certain ones that I do see come in that people are feeding their animals, and I will talk to them in the exam room face to face about this, is like certain diets might be not enough clinical trials or studies are out there to show whether it's complete imbalance and it is healthy for them long term. So, those are some things to take into consideration. And I'm talking about all three of those diets. And those three diets include, you were talking about fresh food diet, home cooks, fresh frozen or raw food diets, and then also commercial or the kibble diets that are out there, okay? And we're not going to get into which one's better than the other, none of that stuff, but we're here to talk about a disease that's really affecting both dogs and cats substantially in the United States, and that is obesity. And part of that is through diet. So what are the methods that are being done? 68% calorie reduction that's being done. I'm looking at the bottom left here on my screen here. 61% are increasing their exercise. 29% are doing a low calorie, low fat pet food consistency diet. And 19% are doing therapeutic or prescription weight loss diets. And there's nothing wrong with what you're just seeing with those data. I mean, that's just real data that's happening. And those are some plans. And these are some plans that we're going to talk about. But when we had the pandemic in 2020, holy smokes, right? I mean, let's just face it, like we all just went to town and ate a little bit of things that we probably shouldn't have because we're home more and hanging with our pets. We weren't able to go to the places that we wanted to. And what subsequently happened is a lot of these animals did end up becoming obese because of the lack of exercise. And so that kind of has shifted the mindset and how we go about treating our patients moving forward when we identify and recognize obesity as a disease, especially from the pandemic, because we had a lot of animals that were overweight or obese. And so we're in the same place with them. And there was a surge in pet adoption that happens. There were these quarantine diets that were happening too. I'm sure you were seeing them come across on your social media, like diets to try out because certain things were on back order, manufacturer back order. So you had to be innovative. And guess what? Certain diets are still on back order as well. So that also creates some problems too. We had some sick pet parents. They couldn't necessarily take their animals out and walk them and take them out. Or there was so much walking that they were on like the flip side of it too, that maybe they had osteoarthritis and they couldn't go because they wanted to walk. So there was all these different outliers that are affecting it. Now, I'm going to spend some time here talking about the body condition score. And if you can, I encourage you to take a screenshot of this picture because this is a game changer on what I talk to my pet parents about all the time. This is valuable. So the body condition score is a subjective way in which you and I identify your pet's weight, okay, and overall body condition. And this isn't just on overweight or obese, but we're also looking at things that are coming in as emaciated. So I direct your attention to right smack in the middle of that gorgeous yellow Labrador Retriever. And there's two ways at which you go ahead and you look at your pets. And I want you to do this. This is your homework assignment after we're done this evening. And I hope you DM me and tell me what your pet's body condition scores are. I'm not kidding. I'm talking to you, Bonnie, Eileen, and Mary, and Barb. I see you. It's like romper room. So the body condition score of a 3, that's what we're looking for, okay? So there's two ways that you're going to be looking at your dogs and cats, from the side and then directly over them. So again, look at the one right in the middle. Now that is a 3. And the reason why is, see that abdominal tuck? See how the chest goes down? I should use my pointer. I forget I can use it. She has the chest goes down and it goes right on up to the inguinal area right there, the groin. That is a beautiful abdominal tuck there. And then you look on over them and they have like this hourglass-like appearance that you see. So they should be going in. So in other words, you should be able to feel the ribs, but not see the ribs, okay? So let's move on over to a body condition score of a 2. Now, this is an underweight one with 5 to 15% body weight. So these can be from conditions of metabolic conditions, cancer conditions, or malnutrition, of course. But the bones are raised, minimal tissues between the skin and the bones. So this is when you can actually feel like their shoulder blades a little bit. You can actually feel their ribs, maybe over their hip area where they can deposit some fat. That tends to be gone. So you can kind of see their hip joints a little bit. I mean, if it's a greyhound, completely different scenario. They're like walking anatomy lessons, but for the Labrador Retriever, there's that. Now, when we see a 1, these are things that really raise the red flag to me, as if severely malnourished. I mean, you know, when I worked in shelter medicine and we've done a lot of rescue of animals that were in like hoarding situations or just street dogs, really thin, emaciated. You can actually see their heart even beating. That's how thin they really are. So it's pretty remarkable and sad at the same time. But there could be other reasons too. That could be a 1. Okay. But for the scope of what we're talking about, let's transition on over to 4 and a 5, because this is where we want to try to avoid and also become educated further about this. So now I want you to know the difference between an overweight dog and an obese dog. So far you have heard me say those words, overweight and obese. I never use those words interchangeably. I never use them interchangeably. You can have an overweight dog that is 26 to 35% body fat. In other words, it's difficult to feel their ribs. They're kind of looking like a little thick sausage linky dog. See how on the right here that you lose that hourglass waist, and then see how you lose that abdominal tuck that's there. It just kind of goes parallel to the withers. That's a 4. So that's still overweight. We can still talk about diet. We may not necessarily talk about therapeutic diets at this point, because we can get that weight off a little bit quicker. Now, obese is a serious situation, and that's a disease. That's over 35% body fat. The ribs are difficult to feel under that thick fat. See how you get these rolls that you're seeing over here? Of course, depending on the breed of dog, because if this is a French Bulldog, they just have rolls upon rolls near their hiney. But on the side here too, very thick. And you're going to also be noticing that these dogs are having difficulties being mobile, moving around. They're going to be painful. Now, I'm going to say something to you that I hope is new, and we're going to be able to recognize this, that obese dogs live an inflammatory life. I'm going to say that one more time, because this is a really big thing for you to understand. An obese dog lives an inflammatory life. Those fat cells called adipocytes, now research shows that they have pro-inflammatory or inflammatory mediators that are associated with it. So they're living in an inflammatory state. So it does make sense that they will develop osteoarthritis or have pain, difficulties breathing because the weight's bearing them. So they're just living a constant inflammatory state. So there's going to be some things that I'll mention moving forward in a little bit of how we can get that pain under control for these guys too. So I want you to consider this. So yes, we're going to talk about diet and exercise, but we're also going to be addressing pain. Okay. So remember that. And that really does resonate when I talk about that in the exam room to pet parents, because no one wants their animal living in pain. No one wants to live in pain. So another thing that you're going to see if you come across this at your veterinary hospital, there's the one called by Purina. This is 1 to 9. Now, I just can't remember more than 5. Like, I'm lucky I can remember 3 things out of like a takeaway versus like 9. But so you might see 9. So I just want to keep that on your radar. There is one called the 9. There's one called the 5. And they have this for cats as well. Okay. And so remember, cats certainly no different than dogs when it comes to how we go about treating and managing them. There's one disease that comes top of mind for our cat parents out there, and that is diabetes. So they both are prone to it, but cats have a little bit higher propensity of developing diabetes. Okay. So we want to make sure of that. Now there's other issues that we can rule out too. Some of you may think that your dogs have hypothyroidism. In fact, many of your dog parents out there wish that your dogs had hypothyroidism because it can be an easier fix. I agree with you, it can. But remember, hypothyroidism is permanent, right? They're always going to be on Suloxone or thyroid tabs or whatever it's going to be that you're choosing or the vet's going to prescribe. But versus obesity, remember, that's reversible. Obesity is a completely reversible disease. Now, there's not many things in veterinary medicine that I wish I could say that's completely reversible, but there's not. So, okay, I'm going to take a pause here for a second, and I'm going to ask my friends here in the audience, what do you think? Well, you know, I had to throw a dachshund on there, right? So let's just kind of go through subjectively. If you want to put it in the chat, go ahead, or call it out yourself. What do you think this dachshund is on the far left? So we talked about the abdominal tuck. So my question to you is, are we overweight or underweight? That's an easy thing to first ask yourself. So obviously this dog is overweight, right? And so the question is, are we at a 4 or are we at a 5? Well, this dog is definitely painful. Neck is extended, difficulties breathing, really loss of abdominal tuck there, and you can't feel or see the ribs, and it even has a hunchback. So I would put this dog at a 5. This dog would definitely be body condition score at a 5 for obesity. Now, our cute poor kitty on the far right here is definitely underweight. And I would put this body condition score at a 1. So this is extreme emaciation. Seeing the ribs, this is actually a really bad, sad case, but that ended up doing great. The cat got adopted out. But very emaciated, very thin, can see the bones, even see the ribs. So, you know, not good.
Let's talk body condition score, also known as the BCS. A BCS is a subjective number from 1 to 5, with 3 being normal assigned to your pet based on evaluation of fat at key locations on their body. 1 means severely underweight, 5 is obese. Let's look at this cutie. So you should be able to look over their body like this, and they should have a nice waistline and abdominal tuck that you see here. You should be able to feel the ribs but not see it. This dog has a body condition score of a 3. You're perfect. So look at Murphy. See how he's a little thin. I can see his ribs. I'd give him a body condition score of a 2.5. So this kitty has a body condition score of a 3. Nice, very nice. So what's the body condition score here? What do you think this is here? So I could see her ribs a little thin. What number? I give her a 2. Body condition score for BCS 5. 5, obese. 1, emaciated. What's your fur baby?
Okay, so I can't stress this to you enough. This is a great video from TikTok that I love to educate on nutrition and you know, obesity, but the body condition score is really a great tool for you all to work on. Easy, everyone can do it. Even I teach children how to do this in the exam rooms because it's important for kids to learn as well. So what are those risks? So we earlier talked about endocrine diseases, but did you know about cardiovascular diseases? I mean, certainly we're putting a lot of weight on that blood pumping those hearts out to all those tissues that are overweight and obese. So endocrine disease, osteoarthritis. Remember, I just said that these obese dogs and cats are living in an inflammatory state. Osteoarthritis, itis means inflammation, arthro meaning joint, osteo meaning bones. So inflammation of the bones and the joints is osteoarthritis. Endocrine diseases we were touching on, hypothyroidism, diabetes, and even Cushing's disease too. I always like to throw in there, which is an endocrine disease. So remember, again, another key takeaway for you to learn when you go to bed at night, you're going to say, Dr. Christman taught me obesity is a disease. So fun fact, when I go to bed at night, I try to recall at least one new thing that I learned each day. One thing. I love to learn. I love to teach, but I love to learn. So I try to learn one new thing. And I'm going to share the one new thing that I learned just as of today that I put in the slide deck for you, because I'm thinking this is cool. I need to share this with my friends. But I challenge you to do that. Try to learn one thing as we get older. It can be hard. You know, it's easy to be like comfortable, but get uncomfortable with learning. I think it's such a great thing, great tool. So learn one new thing.
It's the summertime. I want you to keep your dogs nice and lean, especially if you have the dogs like French bulldogs and pugs, the brachies of our breeds. Like this guy. Hey, Doug. Now look over him. See his body condition score? He's a little bit on the heavier side. He should have a little bit of a waist right here, and you lose a little bit of that abdominal tuck. So his body condition score would be at a 4 out of 5. You need to lose a little bit of weight, my buddy Chris. So take a look at this guy. That is obesity, and that's a body condition score of a 5 out of 5. So chat with your veterinarian about ways to get that weight off of them. Diet, exercise, enrichment toys, even swimming works. Remember, obesity is a reversible and treatable disease.
So that's another good video that I like, because that poor Greater Swiss, was it Greater Swiss Mountain Dog or Bernese Mountain Dog? I just realized, I forget. But that dog was really arthritic. When I saw her, she had such a hard time getting him out of the car. And I saw him doing the head bob and the limp. I'm like, oh my gosh. And she's like, he never had this issue until it became really heavy. I'm like, yeah, you know, because he's in an inflammatory state. There's some other things that were going on, personal life that were affecting the dog and so forth. But, you know, we're able to get that weight off. And I got to take an after picture because that dog looks great. All right, so let's talk about treatment plans. So I know that when I said earlier, like, yeah, it seems so much easier, diet and exercise, feeding the right food. Now, if you're interested in home cooking your food or learning more about it, balanceit.com is a great website. So write that down, balanceit.com, certainly a great website. It's through the American College of Veterinary Internal Medicine, and there's nutritionists that are there. And I think that it offers you solutions. There are some foods that you could buy through that website or whatever, but you can put in things like broccoli and carrots and a protein, and choose like other carbohydrates that you might be doing. Now, remember, some of your dogs may have food allergies, same thing for your cats. So it is something to consider, if you're looking into doing home cooked diets. There is a diet, a book on Amazon called Home Cooked Diet Recipes for Dogs and Cats. That one's good. Now, the only thing that I find as a veterinarian, this is just my opinion, is that I find the animals that are on the home cooked diets, it takes much longer for them to lose the weight. I think a little bit of this and a little bit of that works, and you'll see what I mean in a second. And I want you to discuss exercise options. Now, that big dog, if I was to say, Mom, yeah, I just want you to walk him around the block. He can't move, So we chatted about swimming. I think swimming is a fantastic option, whether you have a friend that has a pool or you go into hydrotherapy. Physical therapy, if you look that up, depending on where you live, my friends, look up physical therapy, because there's a lot of great rehabilitation facilities that are out there. It's not just from recovering from back diseases or orthopedic diseases. It could also be for obesity management. And then implement a program. And I always like to say, I want to set you up for sex yes versus sex no. We want to work together, not against one another. Okay, so this is my fun fact that I learned today, everybody. So excited to share with this. So this is a company called Companion. This is brand new, okay? So finally, there's something with artificial intelligence. And it's AI is, just so you all know, my friends, pet parents out there, AI is huge in the veterinary space, from x-rays to looking at cells under the microscope, to blood work, the list goes on. So it's been around for a few years, but it's really kind of gaining more and more momentum. And this is interesting because it's using AI technology to work on body condition. And so therefore, when you come in to see me, we take a picture. You're going to take a picture of your pet, and it's going to tell me right off the bat what they look like, what their body condition score is, what they could, where the weight is specifically. And then we can map their trends. Now, this is also a behavior device that you see in front of this dog. And it is, in my opinion, one of the biggest game changers that you're going to see in how we go about training our dogs and cats, but dogs specifically right now. It uses facial recognition technology. It distributes treats. It's a whole boatload of information that is going to be released. I believe this summer is the first launch. So look up Companion. There's your first tidbit, or your tidbit before you go to bed tonight to learn about it. I think this is incredible. It's an incredible tool. Dr. Ernie Ward, huge shout out to you, Dr. Ward. He's been very instrumental in using AI technology. This isn't just like someone that doesn't know what they're doing. Dr. Ernie Ward has spent many, many years on canine obesity councils and lectures and research. So it's really, really well backed, and lots of great trials are being done. So I think it's wonderful. So here's what I say if you were to see me in the exam room. I know you didn't think Milo was obese today, but we are going to work together to help get the weight off of him so that he can be with us for as long as possible. We will do this. You need encouragement. If you think of like these programs like Weight Watchers that are out there on the human side, a lot of it is mental health too. You need a coach to get you along the way. When I had a Chihuahua that would lose 4 ounces in the week, an owner would perceive that as like, oh my gosh, only 4 ounces. But I would be parading that Chihuahua around. I was like, oh my gosh, Bella just lost 4 ounces. So that way you feel encouraged and empowered. We even did things at our hospital, like the Biggest Loser challenges, or we did before and after pictures on social media to really showcase the urgency, the importance, the physical differences, and the raising true front awareness for our dogs about obesity as a disease. So I really think that's important. Have you guys heard of this? Some of you follow me, I'm a huge fan of Playology toys. These are scented toys that have encapsulation technology in there. And so this is the scent that you see in front of you is peanut butter, but there's beef, there's chicken. And so they're not consuming calories, but they're engaging. This is great for those that are in that inflammatory state that can't maybe be so mobile just yet, and you want to work with them. You can even put, like what I do on the one on the far right with Chelsea, I put toothpaste in there with her because she's older and I can't brush her teeth as much, so she gets to chew on that. It smells good to her, but also I put some toothpaste in there. Enzymatic toothpaste, remember, like CET toothpaste or cross-sex toothpaste. But These are great. So look up Playology toys. They're available like on Amazon. They're at PetSmart, Petco. It's not for all super chewers because I get asked that all the time. But I do think swimming is a great way to go. This is a great time of the year here in the United States, at least, where it's warmer out to swim these guys. Make sure you have a life jacket on them. I'm a huge fan of that. And they're going to need help too. Remember, obese dogs are not going to be in there very long. So maybe 5 to 10 minutes, but they're going to need that assistance. And I'm a big fan of PROM. Have you heard of PROM? Passive range of motion exercises. So this is a dog that's using a hydrotherapy. Now, if I told you how many years I've been doing this with my dachshunds just because of their back issues, but there's a treadmill that you see right below you, right there, and then the water is filled up right up to their chest to give them that buoyancy that they need to get mobile and move around. So this is a great tool. A lot of rehabilitation facilities have those available, and like you would just get like put into some sort of a regimen or a treatment plan. And so it gets those joints moving while we're working on other modalities too. So that might be something newer that you haven't heard when you hear diet and exercise. It's not your typical, let's go to the dog park type of a thing. This is what I think of how we can decrease that inflammation while they're being getting the weight off of them. Now, if you haven't heard of the Assisi Loop, I want you to get one because one, I think every dog and cat needs to benefit from the Assisi Loop because there are so many reasons why. In fact, I'm dropping a TikTok video tonight that you're going to see. I'm mentioning the Assisi Loop because of noise sensitivity. But for this instance, it decreases pain and inflammation. So I put this as part of the treatment regimen for my obese patients, okay? Because those joints hurt, my friends, they hurt. And so by putting the loop on, which is a non-pharmacologic way of using targeted pulse electromagnetic wave technology, and doesn't have to worry about putting them on like opioids or prescription medications, but this has many sessions that are there. You can go to the website, assisianimalhealth.com, and you could look into it. There's even like a calmer canine thing that they can lay on with a loop under it. But don't forget to address the pain. I'll say it one more time. Do not forget to address the pain on these obese and overweight dogs and cats. They need it. Now, remember, this is both for dogs and cats. And also, it's good for us. Like, I suffer from migraines every day. So I'm holding my head up. I have another one. And so I'm going to be looping myself up afterwards because I'm going to need it. So look up to this CC loop. But other modalities that it's used for, like post-surgical recovery, wound care, spinal nerve disorders, bone joint issues like we're talking about, osteoarthritis, please look into it. If you haven't, talk to your veterinarian about it. Again, it doesn't require a prescription, but I do think I include it as part of the treatment regimen for obesity. Okay, so stairway to weight loss success. As we're wrapping up, we're going to calculate the calories that we utilize, recommended diet by the veterinarian. I don't want to dismiss this, okay? I really don't. This is important. Diet is really going to be crucial. Sometimes it might be a therapeutic diet that I put these kids on. So, for example, it might be a Hill's prescription therapeutic diet. It might be Royal Canin. It might be Purina. But that's important because those therapeutic diets are designed to decrease that weight in a safe and effective way. Now, when I hear pet parents that say to me, yeah, Dr. Christman, I got them on like something over the counter. I got at the store. I got like a weight management. Well, I said, I want you to listen to those words. Weight management. It's going to do exactly that. It's going to manage the weight. It's less likely to lose the weight unless you significantly scale back them. Now, this is what I was just talking earlier about when I was referencing balanceit.com and how we were talking about those that are interested in feeding and consuming just table food. I don't say table food, like home cooked diets, I should say. We want to mix it up. Now, this is where I love. So, carrots, broccoli. There's other great fillers that you can add in with their food or use as a treat that could be just as effective for weight loss. Now, the number one thing that I always hear is that my dog is hungry, my cat's hungry. So if there's a way that we can increase the fiber content, which is what a therapeutic diet has, there's one that Hills has called Metabolic, which I think works great. It works with your dog's and your cat's metabolism. So it's a little bit different mechanism of action on how that works. But any of those diets, you do want to do a slow transition over 7 to 10 days because we don't want them to, one, get a food aversion, and two, have significant dietary indiscretion, whether it be vomiting, diarrhea. And that's just with any diet in general. Now, cats are a little different when you do this. I'm sure you've heard this. Instead of dogs where you do like 25% decrease and then increasing their food over periods of time, cats, I do a side-by-side comparison. So they get their regular food, they get their new food, you know, regular or old food, new food, old food, new food. And I slowly decrease the amount over time, but that way they get to make the choice without them having a food aversion. So talk to your vet about that. And then exercising for 15 minutes. And like I said, we talked about playology toys. There's the fetch it toys that you could do, you know, things that if you have, now remember, we're talking in a newer time about spectrum of care with even pet parents. Sometimes 10 years ago, I would just set expectations that were unrealistic and I didn't even realize I was doing it. So maybe I had geriatric clients that had rheumatoid arthritis. I'm like, yeah, take them for walks. I'm like, shoot, I didn't realize that like they're not going to be able to do those things. So what are some tools that they can use? So I'm a big fan of like the fetch it things, like where they can throw the ball. If they have tennis elbow or other ideas or other elements, there's other things that are out there that can create some sort of like movement. Movement is so crucial for you and I, as well as for our animals. So if it can't just be us, maybe it could be a neighbor or a friend that can do it. And always follow, follow, follow. Do not leave your exam room or when you get diagnosed that with for your dog or cat, do not leave that without a recheck. So use the scale. Hopefully they like the scale. I just got Capone used to getting up and placed on the scale with treats. You got to use it. It's got to have a positive experience. You know, just a total side note, I don't know if you know this, but one of the biggest fears that dogs have is the fear of falling. And so when they go onto an exam table, they're up high, they get scared. So you try to desensitize them. I mean, I'm fear-free certified, so I do lots of like good healthy treats and snacks, whether it be baby carrots or whatnot. But just keep that type of mind. Like if you're going to be going in for frequent like weigh-ins or whatever, throw some treats on there. You know, make it a fun experience for them, whether it be a high value treat that they haven't had before. Do it. Even something freeze dried. Ooh, they love that stuff. I love you forever. So an acceptable weight loss amount typically is 1 to 2% of their total body weight per week. We don't want to be drastic because it can cause some significant issues, nutritionally speaking and metabolically speaking. For cats, it's usually 0.5 to 2%. So not much. So, you know, and I just use this example over here that like if you had a 200-pound, if you had a 100-pound Labrador Retriever, he can safely lose 1 to 2 pounds per week to target him to maybe be around 85 to 90 pounds. So just to give you like a little perspective on that. So, you know, measure your pet's. Hold on, I'm going to get close. Measure your pet's food. Don't use like coffee ground canisters. Don't say, hey, this looks good. Literally go to the store, get some measuring cups that are just for your dogs and cats, no matter what you're feeding them, okay? And level that food. Make sure you're looking at what a half a cup looks like. So that image on the far right makes me want to clench my pearls because that's a heaping cup of food versus a cup of food, okay? So maybe your behaviors need to change, and that's okay. That's okay. You know, we're busy, we're doing this, that, and the other thing, giving them treats throughout the day. How many treats are you giving your dog? So when I ask that question, when we're doing an obesity assessment, I'll say, what else? Because typically they'll keep going. You pet parents will keep going and say, oh yeah, they do get a piece of cheese before bedtime. Oh yes, they do get some string cheese after they go potty. Sometimes my dogs just go outside to come back in just so they can get a cookie, and they go by the cookie jar. So they get another cookie, they get a biscuit here. So think about your lifestyle every day, because you may not even realize that you're subconsciously giving way too many treats or overfeeding them. So vetnutrition.tufts.edu is a great website. Take a picture of this, write this down. It's a really good website, you guys. It's got good, easy, digestible education. It's from Tufts does a lot of great work in the field of obesity and nutrition. So really great stuff when you're looking at like guaranteed analysis, when you're looking at dry matter basis, those questions when you're going down the pet food aisle looking at some diets. They have some really great resources that are there too. I did mention balanceit.com. I do think this is a good website that you could choose your protein rich source over here. You can select a carbohydrate, look at some oils and fats and some veggies. So again, I would always do this with your veterinarian, and then you can also do a virtual consult with a boarded veterinary nutritionist at the same time. So I think it's good. Okay, so for my final thoughts, what did we learn? Thanks for being with me. You know, it's fun. What did we learn? So obesity is a disease. So we're going to treat it like one. So, you know, there's another word that I'm going to teach you, and it's called comorbidity. Comorbidity. Everybody say the word comorbidity with me. 1, 2, 3. comorbidity. Good job, Mary Prado. I'm so proud of you. I see you, Eileen. So a comorbidity is a disease, a concurrent disease that a dog or cat can have, or any animal or us can have. So for example, you may have a dog that's obese, that's diabetic, that has cataracts, that has a heart murmur. Those are comorbidities. And so I want to close and leave this one thought with you. Prioritize. Remember, we want our animals to be living long and healthy lives, but that little tiny little wart life growth that hasn't changed in size, we're going to let that be. But we're going to talk about things that are more pressing, like the obesity as a disease component. We're going to talk about maybe using the assisted loop because they're in some pain. Don't worry, we'll definitely trim those nails, I promise you. But remember, obesity is a reversible disease, and we want to set you up for success, not failure. So be transparent about things that you can and you cannot do. Okay. We want to empower you, the pet parent. It's so important to have a coach with you along the way, and take photos and post along the way as we go, because it's going to be very telling, similar to what we just talked about with AI technology, that stuff is really, really important to understand. So keep those photos around and send it to me. I'd love to see them. I do want to thank our friends at Zomedica and Assisi Animal Health for this great presentation. I love companies that help support the pet parent. I think knowledge is power, as you all know. I love doing TikTok to help educate you guys and bridge any gaps or missed opportunities that we can learn together and grow. So I do have my website, dradamchristian.com. I have a Facebook page, The Adam Christman Show. My Instagram is where the party's at, so you can see all the great pictures of Capone. And then, of course, TikTok, Dr. Adam Christman 52, my YouTube channel, and follow me over on LinkedIn as well.